I'm Hrishikesh Kumar. I'm Head of Neurology at Institute of Neuroscience of Kolkata, and I'm Program Director of Parkinson Disease Program. I see a lot of patients of Parkinson disease. I see about 40-50 patients of Parkinson disease every day. And when I interact with the patient, I'm surprised to see that despite knowing about this disease for many years, a lot of misconceptions are there in the society. And the biggest misconception is there that Parkinson disease is a brain disease and not treatable. That's completely wrong. Among all the brain disease where there is degeneration of nerves, Parkinson's is one disease where treatment is possible by medications, by exercise to some extent, and by therapies like deep brain stimulation or DBS therapy. We have to see all cases of Parkinson disease, all patients of Parkinson disease may not respond well to DBS therapy, and we select the patient as per some criteria. And the most important criteria is that if the patient is responding to dopamine or levodopa, responding well, but response is waning off. They are not doing well on levodopa for a long time, they are doing for only short time. Or if the patient develops some complications with levodopa known as dyskinesia, means dancing movement, then life becomes very difficult because they are taking medication doesn't work that well. If it works, it causes dyskinesia. And in that case, we choose the patient for DBS. They are good candidate for DBS. If the patient is not too old, not more than 80 or so, if the patient doesn't have bad cognitive problem, is bad dementia, in that case, DBS will do well, and we ask the patient to go for DBS. There are some patients where there is no on-off phenomena, means after medication, there is no change at all. Still, we choose for DBS, and those patients are tremor-dominant Parkinson disease. If somebody has bad tremor, they may not respond to levodopa that well, but they respond to DBS very well. The question patient asked to us that what is DBS? Does it mean that you remove your brain? No. In fact, DBS, I will say the DBS is one surgery of brain, which is one of the smallest surgery. It might take more time on the operation theatre, but you don't open the skull. You just put an electrode or pacemaker inside the brain. You can say the brain chip some chip in the brain, and that's through a very small hole. So complication of DBS is minimal. As compared to any other brain surgery, when you see complications minimal because we are not opening the skull, we are just putting electrode in the brain, and patient remains awake in majority of time during the DBS. Then they ask that is it painful? In fact, DBS is one of the most painless surgery because we just put hole through a local anesthesia and patient remains awake. They don't have any pain at all. And when we put the pacemaker, that means after putting pacemaker, we put battery in the chest. During that time, we make the patient under GA or sedation. So it's almost painless surgery. After that, what happens after DBS? Means what patient expects after DBS? There's one point here that after DBS, we tell the patient that this is not cure. This will improve your quality of life for say 10 years, 15 years or more than that. This will reduce your medications significantly, so medication complication will be diminished, but it's not curing you. What happens just after DBS? Just after DBS, patient improves significantly. The word we use, lesional effect. That means you put the hole in the brain, and that itself improves patient. And after that, it's fine-tuning. As you fine-tune your transistor radio to have proper sound, we fine-tune the voltage in the brain so the patient remains good for long time. And this fine-tuning we call as programming, which is done from outside. So nothing inside after that. From outside, we do programming every say few months time, and patient remains well for long time. So this is a safe surgery. This improves quality of life significantly, and it needs some tweaking on and off, what we call as programming, and because of that, you reduce the number of medications. Another question is that patient asked that after DBS what exactly DBS does to the life? I can tell you that if a patient is selected well, this changes the game. This is game changer. This changes the quality of life. So a patient who had bad tremor, who cannot walk at all, or who walks for only 1 hour because of on phenomena, on DBS they are almost normal or best on phase for 24 hours. So to explain the patient, I tell that you're not taking medicine from outside. In fact, your brain is making dopamine, in a layman word I would say, through stimulation from inside. So this more natural than taking medication which you're taking for on and off. And function improves significantly. In fact, apart from motor symptom, means walking, tremor, slowness, patients' non-motor symptom also improves to some extent. Means lethargy also improves, sleep improves, because during the night time, when you are on medication, you cannot take medication whole night. But DBS is working throughout the night, right? So it keeps your body supple, and sleep also improves. despite seeing thousands of patients, what I have learned from Parkinson's disease, or what I have seen in the patient, it's quite surprising that each patient is still different. Each patient has their own set of various combination of symptoms. Each patient has its own social support. Each patient has its own mental setup. So I can tell you that each patient is different. So despite knowing about the treatment of Parkinson's disease, one formula doesn't work in all. So this is quite surprising that this is not, there's no single formula for all the patients.
Say yes to DBS.